Welcome now an authority on infectious diseases, Michael Osterholm of the University of Minnesota, where he is director of the Center for Infectious Disease Research. Dr. Osterholm served earlier as on President Biden's COVID task force. So, Dr. Osterholm, thank you for being back with us. There's a lot of talk about boosters right now to try to combat this Delta variant. Will they be helpful, and should they be given to more than just the people whose immune systems are severely compromised?
Well, I think, first of all, we want to basically understand what we're talking about with this new group of individuals that are being addressed. These are people, as you pointed out, are immune compromised or have immune suppression from either a previous illness or taking certain drugs. Many of us would not call these booster shots. These would be more the continuation of the primary series, meaning if you think about children, there are some vaccines for which we give 3 or 4 different doses before we consider them fully vaccinated. These are people that never fully achieved protection to begin with, and that's what we're seeing here. So this 3rd dose is not a booster in a sense. It's more of just continuing the primary series to get these people to some level of protection. Booster shots as such are when people are fully vaccinated, they have a good response, but then over time that wanes, meaning that the antibody or the immune protection we have drops. And that's going to be a big challenge. That one we're looking at carefully because that really starts to set in potentially 6 to 8 months after you've completed your series. And there's some initial data coming out now that says that, at least for some of the vaccines, it may be necessary to maintain your protection to actually have a booster shot. But that's something we're still working on and trying to understand.
Well, Doctor, I'm so glad you took us there, because one of the questions I wanted to ask was about the fading of the effectiveness of these vaccines, because I saw a report just today coming out of your neck of the woods up in Mayo Clinic that perhaps we're losing something like 6% of the effectiveness of the Pfizer or maybe the Moderna vaccine every 2 months. Now, as I understand, that's not been peer-reviewed, but does it look like that's where we're headed?
Well, let me just set the context for this, because I think it's really an important point that the discussions we're having right now is what I call corrected science. It's a situation where we're learning more about how the vaccines work over time, as we have had more time now since we first were vaccinated. We want to be really clear to the public, these are not questions about safety. And so therefore, nothing we're talking about right now should deter anyone from getting a vaccine. It's not about safety. It's about, are we going to need additional doses of the vaccine? And again, this is the number 1, 2, 3, and 4 thing you can do to protect yourself. So it is possible that what we're seeing right now is with some of the vaccines, and the data still are a bit unclear, are all vaccines acting the same or performing the same? And just expect that over the course of the next 2 to 3 months, we're going to get more information. That means we're going to go back and reconsider the best way to deliver these vaccines. You know, we could have easily done these kinds of studies over the course of a year or 2 and not have licensed the product or make it available, but how absolutely terrible that would have been in terms of the lives saved by having these vaccines out here. So we expect to see, in a sense, mid-course corrections, you might say, and how we deliver the vaccine in terms of the amount, when it's delivered, but these should be expected and not seen as any reason why not to get the vaccine now.
Dr. Osterholm, help me as a public health real expert. How do we balance, on the one hand, giving booster shots, and I take your point about the clarification that the people who are immunocompromised, that's not for them, but for the rest of us who've been fully vaccinated to get a booster shot, on the one hand, and getting the vaccine to people who've never been vaccinated, not just in the United States, but around the world. Because as I understand it, this virus will keep going and keep morphing until we really get it under control, and it can be a danger to us back here in the United States.
Right, and thank you. Yeah, that is really an important point. And as you know, last week the WHO actually issued a statement urging countries to call a moratorium on booster shots until at least September 10th, with the hope that we could accelerate getting vaccine to low and middle income countries. You know, we are basically experiencing the riches of vaccine in high income countries, while if you look at the 6.4 billion people in low and middle income countries, less than 2% of the population has had any access to vaccine. Now, why is that important? Well, surely from a humanitarian standpoint, it's obvious. But even more specifically, if you look at the strategic protection of our vaccines, you know, we hear us all talking about the concern about variant development here in the United States when people get infected from not being vaccinated. But when you want to ask yourself, where's the real risk of these new variants that could potentially get around the protection of our current vaccines, it's the low and middle income countries. We have got to stop transmission there among the 6.4 billion people who have no protection. So you raise a very, very important point. And this is an ethical issue, and it's also, frankly, a strategic planning issue. So we, I think, need to balance, do we want to keep giving booster doses to people in terms of protection in high-income countries at the risk of seeing these people in low-income countries getting infected and more variants coming at us? In the end, that may be the biggest challenge we have to keeping the vaccines working.
Coming back to the United States, if we could, Dr. Osterholm, you said that
Sure.
there's nothing that's developed here that should discourage anyone from getting vaccinated. At the same time, we've got a rather stubborn part of the population, if I can put it that way, that seems to be resisting that. What can we do to improve that situation? As I understand it, for example, HHS maybe has just announced you got to be vaccinated. Should we have employers, including government, across the board, just requiring vaccinations?
Well, I strongly support vaccine mandates, and that not because I want to basically impose my will on your body, but this is about protecting the community. You know, we don't let you drive drunk just because you want to and it's your choice. We do that because we don't want you to hit someone else and kill them. And so I think that there's some similarities here in that we're asking to protect the community. The more people vaccinated, the much less chance that anyone else will get infected out there. And so this is an important consideration. I think also when we look at these vaccines and this concern about people wanting to get vaccinated or not get vaccinated, they have to understand they're going to know a COVID-related outcome eventually. You can't run the game clock out here. This virus is so infectious, it'll ultimately find you. So even though you haven't been infected in the first 18 months of the pandemic, it's going to happen. And how many times in just the last couple of weeks have we had camera shots of people in intensive care units on ventilators, you know, that basically didn't want to get the vaccine and now their family regrets that they didn't. Or people who are even not on ventilators who can talk and say, please get vaccinated. I wouldn't, and now I know what I'm going through. So I think we just have to keep hitting home that message. You can't run out the clock. It's going to find you. Do you want to do it in a hospital bed where you may die, or do you want to get the vaccine where your chances of dying are dramatically lower than not being vaccinated?
And finally, doctor, I mean, I hear you loud and clear. The answer is vaccination, get vaccinated, but there's also the mask mandate question, particularly to protect some of those who cannot be vaccinated, for example, children, or even to protect some who haven't been vaccinated. Give us the science on the masks. I know you think we should be wearing N95s, but what about fabric masks? Do they give you some protection?
Yeah. Well, you know, I very much support masking as part of the way that we, in a sense, protect ourselves beyond vaccination. But again, you have to have an effective mask. And that's what has been missed in a lot of the discussion, is the fact that if you basically put whatever you're going to use to protect yourself on, and you're in a room with somebody smoking a cigarette, if you can smell that, then which smoke from a cigarette is an aerosol, the way we know that the viruses are now transmitted, then you know that that is not protecting you adequately to keep you from getting infected. And research shows that if you wear a face cloth covering, you may get an additional 5 to 10 minutes protection in a room where someone is there than if you had nothing on at all. If you wear a surgical mask, you may get 10, 15 minutes of protection. If you wear an N95 mask and you fit tight to your face, you get, in some cases, up to 25 hours of protection. And so I think that the challenge we have is dealing with this mask or non-mask issue, which is terribly unfortunate. It's about mask, yes, but use the best protection you can. And for kids, that's a challenge because we don't have routinely available N95s available for kids. However, we do have a similar type of product, largely made in China, called a KN95, which does have fit locations and for kids to be, in fact, protected. So I just urge people to use that.
Boy, that is terribly helpful and very specific. I really appreciate that, Doctor.